Hello everyone, welcome back to my channel. Today we are going to talk about Xeroderma pigmentosum, as I also remember it as the vampire disease. Why do I call it a vampire disease? Is because in as a vampire, the person with Xeroderma pigmentosum is very sensitive to UV radiation or very sensitive to sun rays. Yes, they do not die as a vampire, but basically it happens something like that. I'll tell you why. What happens is when our skin is exposed by the UV radiation, it get damaged, and this damage is repaired by a body, but the repair is impaired because of certain genetic disorders, and since body cannot repair the damaged skin, it leads to xeroderma pigmentosum. What happen in this disease is our skin goes undergo a certain changes. There is going to be atrophy of the skin. Basically, skin cells going to die. A lot of skin cells going to die. So skin become very thin. Telangitis. What is telangitis? There's dilated small blood vessels on the skins. You'll feel you because there is ongoing atrophy, and because of atrophy, our blood vessels are visible over the skins. Hyperpigmentation. This pigmentation is secondary to UV. See what happen is when a body is exposed to certain damage, a certain level of thermal damage, a body produce a lot of melanin, and that melanin lead to hyperpigmentation. Freckles because of impaired healing and damage. Dry skin, very obvious because sun is continuously killing our cells, so skin is not able to reheal itself. Limited hair growth because of atrophy also, and because of damaged roots of the damaged hair follicles, damaged root of the hairs. Coronal ulcerations, as you can see in this picture, everything just feel like the person is just walked out from a very big explosion. It is exposed to a nuclear blast. You can watch the X-Men, the Wolverine movie, in which you can actually see the Wolverine getting exposed to the nuclear blast, and you can see all these changes in its face. So that's a very good example to remember it. See, there is no sexual relation. Anyone, even a male or a female, could be affected by it, and it's usually detected in first or second year of the life, because in that stage a person is slowly exposed to the skin, and which could lead to early exposure of symptoms. See, now that our skin are usually dying and undergoing a lot of repair, a skin may develop malignancy, may develop skin cancer. The most common is squamous cell carcinoma. Melanoma could occur because the body is trying to produce a lot of melanoma in the state, and basal cell carcinoma, even in certain cases, fibrosarcoma, but squamous cell carcinoma is still the most common tumor. It is mostly occurred in sun exposed area, right? Not on the trunk area, which most of the time they covered with the cloth, but the face or the hands or the palm area, right? And it is mostly visible in the as early as 4 to 5 years of the age, because you can see the at this stage only, because this child is just 4 to 5 years of age and still having a malignancy because of the impaired healing. Oral manifestation, there's no not much of the oral manifestation in this disease because the skin and the sun exposed area is most prevalent. So a lesser part of our oral cavity is exposed to the sun. You patient may show with cheilitis, angular cheilitis, or actinic cheilitis. Patient may have limited or painful mouth opening due to perioral ulcers, perioral scars. Patient may develop squamous cell carcinoma of lower lip because their lips are the only part which is most of the time exposed to the sun. In some cases, even the tongue, but very rare for buccal mucosa to have a cancer. Histopathology, you do not find any specific symptom for histopathology, depending on patient having a squamous cell carcinoma, patient having a melanoma, the patient having a lot of damage. Yeah, so based on that, based on the clinical presentation, The histological presentation may vary person to person. It's a skin pathology, so see, it's a genetic disorder. There is no cure for this. The best you can do is limited sun exposure. Thank you very much. This is all for today. We will meet in our next lecture with a different pathology. Thank you very much.